Hello everybody, we are back for another episode of our Body 101 series, and today we're going to be talking about hamstring injuries. So when it comes to hamstring injuries, there are two categories that we're going to touch on. The first is a high velocity strain, and the second is a chronic overuse strain. So these high velocity strains are acute in nature, meaning that they happen in an incident. So if somebody came into our clinic, they would say, yeah, I was doing X, Y, or Z and I felt my hamstring pop or I felt something pull. These types of injuries are usually happening in athletes who are sprinters in track, play football, rugby, anything where there's a lot of high speed, high velocity things going on. These types of injuries, what they've found is your highest risk to have one of these is that you've had a previous hamstring strain, which is kind of interesting. But basically what that means is that they're finding that after students and athletes are returning to their sport, they're not having full recovery of their strength deficits. So there's persistent deficits in their strength in their hamstring and their glutes and other muscles, which is leading to recurrent or again having a hamstring strain. So that makes it vitally important that if anyone has gone through an acute hamstring strain, that they've been in to see a physical therapist to have adequate testing and rehabilitation to restore all of the strength needed, and then have comprehensive return to sport testing to make sure that they're ready to go back so that they don't have this chronic recurrence of these hamstring injuries. The second type of hamstring injury is a chronic overuse type hamstring injury, and these are a little bit more sneaky. So they usually end up feeling more like tightness than they do an actual pull or a strain. So a lot of runners that I know who have this talk about having a really tight hamstring. But when we get them into the clinic and we test their hamstring length, it's actually no different than their other side, but they have persistent weaknesses and they're not using the right muscles when they run. And so in these people, the tendency is to continue to stretch a muscle that feels tight, even though the tightness that they're feeling is actually a tear. So if you can imagine taking something that's slightly torn or a rope that's slightly tethered and trying to pull it, it's just going to tear more. So it's important to know, is this tightness I'm feeling true tightness, or is it actually the sensation of chronic overuse hamstring strain? So in our clinic, we do that. We test for that using our EMG. We make sure that you're not overusing hamstring muscles when you're doing your daily activities or when you're running, or for some people it's when they're biking or cross-country skiing. So those are two types of hamstring strains that we just covered today. The good news about hamstring strains is there's a lot of research going into this because it causes a lot of athletes to miss time. And they've also been finding different protocols and exercises that teams can go through to prevent these injuries from happening. So here at Point Forward, we do injury prevention screenings, and we also bring whole teams in to screen for these and then teach you guys which exercises you should be doing. So we would love to work with you when it comes to your team or individually if you're having tightness in your hamstring or if you have an acute hamstring strain and you want to get back to your sport without it happening again.